We now head down south of the continent where the nationwide crackdown on healthcare practitioners operating illegally launched the Health Professions Council of South Africa is gaining momentum with arrests made in different parts of the country. Minister of Health Joe Phahla confirmed the arrest of 124 fake doctors following a crackdown by the Health Professionals Council of South Africa over 3 years now. Phaahla said the unregistered doctors evade the system by joining the private sector where they can be paid in cash or operate in practices of registered doctors. The association is mandated to regulate the health professions in the country in aspects pertaining to education, training and registration, professional conduct, ethical behaviour, ensuring continuing professional development and fostering compliance with healthcare standards. Now, to speak more on this, we are joined by Chairperson of South African Medical Association, Dr. Vusisi Mzukwa, of course, to shed more light on this. Thank you so much for your time.
Good morning to you and to your viewers. Thanks for having me.
All right, so let's get straight to it. Now, we understand that these bogus doctors were arrested over a period of 3 years, and this shows that cases of people masquerading as doctors are not new in South Africa. However, one might even say maybe not new in the entire African continent. But certainly this calls for some level of concern. Don't you think so?
It is a serious concern for the medical profession. But like you said, this is a global phenomenon. Even in Europe, you do find fake doctors. South Africa is not an exception. So we are, as the South African community, have to be empowered to be able to identify these fake doctors.
All right. Now, when we look at a link of, the qualified people, unqualified people, ripping off patients, and also, on the other hand, the shortage of doctors, particularly on demand in South Africa. One might want to say, in a way, maybe due to the shortage, maybe that's why we have the spread of these bogus practitioners. Do you think the amount of doctors in South Africa could be a reason why you have so many unregistered ones trying to fill the vacuum?
No, not necessarily. We don't think that's the case. We think people are maybe desperate, because of unemployment and other things. But we don't necessarily think it's because of the shortages. Because if you compare to what is happening in other countries, even first world countries, where there is enough of doctors, but you still find fake doctors in those countries. So we believe that, there are many factors that are contributing to that. It could be that, the communities are not empowered to identify proper doctors, or else the other problem might be that, the law enforcement agencies are overwhelmed by other issues and may not have the capacity to crack down on these fake doctors.
All right, now let's come down to the, of course, healthcare system infrastructure that we have in the country and how, health personnel are paid. Do you think they are paid enough to remain in the country? Also, what mechanisms are in place to ensure that, patients can actually tell if this is a fake doctor?
Well, doctors in the country, yes, there are challenges. They've been underpaid, obviously, for many years now. But the other thing is, the working conditions are not, very conducive, such a way that it's one of the push factors that is pushing out doctors to other countries, especially Canada, the UK, New Zealand, Australia. But what you've noted as well is the fact that the government cannot employ more. There's a dire shortage of doctors in the system, not because there's a shortage of them production-wise. So it's one of the factors that are really problematic in the country.